Now, given what has developed so far, we have decided to take two major steps forward in order to contain the spread at the dormitories and to safeguard public health. The first major move is that Ministry of Health has this afternoon gazetted two of the dormitories, that is S11 at Punggol and Westlite at Guan, as isolation areas. So that's the first major move. These two dormitories being gazetted as isolation areas. The second major move is to implement further safe distancing measures at all the other dormitories. I will come to that later, but let me now ask my Deputy Secretary, Jason Chen, to explain what happens in an isolation area. Jason?
Hi. So we have communicated to the workers and their employers from these two dormitories that they would have to stay in their dorms, in their existing rooms, for the next 14 days during the period of the quarantine order. We have explained to the workers that this is to protect their own health and safety. It is for their own interest that we're doing this. And they have generally understood the rationale, and the mood on the ground is stable. We will be providing all 3 meals to the workers, and we are also distributing goodie bags that contain masks, thermometers, hand sanitizers, and snacks to lift their spirits, and they have generally been very cooperative so far.
So that's what happens inside the isolation area. Let me now talk about the other dormitories besides S11 and Westlite, what we will be doing. There are 4 subpoints. First, although the number of essential services workers in these dormitories is relatively small, they are a small minority of all the workers who are staying in dormitories, we would want to house the workers in essential services separately and move them out of the dormitories. So we are actively converting more spaces and putting these essential services workers into these spaces that are suitable for this purpose. So that's the first subpoint. Second subpoint, within the dormitories, the workers are really like family. They interact with each other very regularly. So the risk of transmissions is there. We will take further precautions to ensure that the interactions are minimized. There will be further adjustments to their daily routines. Previously, we minimized the intermingling between blocks. Now, we will also minimize the intermingling between different floors. So that's the second subpoint. The third subpoint is that we will further thin out the number of people in the dorms. And this is to facilitate the enhanced safe distancing measures that we want to implement. For the thinning out, we will progressively do so for all the large dormitories. We will work with the Ministry of Health to make the best use of the freed up space to minimize the risk of transmissions at the dorms. So that's the third subpoint. The fourth subpoint is that, in addition, if any of the workers at these dormitories are unwell, even if they are not tested positive, they will be relocated and housed separately in sick bays. This is so that we can minimize the risk to everyone else. Now, the key objectives of all these other measures in the dormitories is really to ensure the health and well-being of everyone, not just our own people, our citizens, but also the foreign workers who are here helping our economy. And for their employers, they are also part of the essential workforce, which we will need when activities restart. We want to give the foreign workers the assurance that these measures are taken in their interests as well as their well-being. Now, there are also a number of questions that I would like to address. These have to do with the assurance to the affected workers and their employers. The first is on salaries, on wages. There is already an established understanding that the period of quarantine is treated as paid hospitalization leave as part of the workers' statutory leave eligibility. So we will work with the employers to ensure that the quarantine workers continue to be paid. That's on wages. The second point on food and necessities, we will make provisions. Jason has talked about them. And the workers will also get masks, they will get thermometers, they will get hand sanitizers and other essentials. We know that it is important to them to still be able to make remittances. We will facilitate remittances on site. And third, on medical care, MOH has deployed on-site medical support to ensure that the workers residing at both S11 and Westlite will receive appropriate care if they were to become unwell. So I can fully appreciate that the workers and the dorm operators have to make many adjustments to their daily routines, and I hope that the workers, their employers, as well as the dorm operators can work together with us on this. We need everyone to do their part. We need everyone to observe the strict measures that have been put in place, and I think if we can do so, we can overcome the situation together.